Member from Parkdale High Park.
Thank you, Mr. Speaker. My question is to the Minister of Health. It's a very sad day for Ontario, really, and there's nothing funny about this concern that we're addressing. The minister has indicated that she wasn't on top of her file during the campaign because, again, the campaign came first. Not only was she making announcements in her own hometown of London, but quite frankly, Mr. Speaker, she was also making announcements as Minister of Health in downtown Toronto, at Toronto Sick Kids no less. On September 18, Sick Kids is a place where they discovered the cystic fibrosis gene, and it's where they invented Pablum, said the Minister of Health, supporting Research and Learning Tower and bringing together these talented researchers under one roof is where discovery happens. Well, we're discovering, Mr. Speaker, what's happening at Orange. We're asking the minister now and once and for all, she didn't take responsibility. Will she take responsibility? Will she resign?
Minister of Health.
Speaker, I have taken full responsibility and I have made significant changes at Orange, Speaker. We have completely new board in place, Speaker. We have a new CEO in place. We have a new performance agreement, Speaker. I have introduced new legislation. I sent in a forensic audit team, Speaker. The forensic audit findings led to my ministry referring this issue to the Ontario Provincial Police, Speaker. The Auditor General himself acknowledges the sea change in leadership at Orange, and so do the frontline paramedics, the pilots, the frontline staff that I have met with, Speaker. Things have changed at Orange. I take my full share of responsibility for the findings in the Auditor General report, and I am acting on every single one of these recommendations.
Thank you. Supplementary.
Thank you, Mr. Speaker. Actually, looking ahead, the reality is still Orange will be exempted from Freedom of Information rules. Orange will still let executives line their pockets with limited healthcare dollars, and Orange will not be able to be called before the Government Agencies Committee. Wow. So nothing's going to change, Mr. Speaker. Absolutely nothing is going to change under this minister and with her ministry. She hasn't taken responsibility. She's not going to take responsibility. Will she at least do the honourable thing and resign and let the Ministry of Health get on with their work?
Minister of Health.
Speaker, the member opposite might think that this legislation doesn't change anything, but she's completely wrong. I would urge her to read the legislation, Speaker, to understand that the changes are significant and real and will make a tangible difference to Orange people, Speaker. The people who rely on Orange to get the care when they need it expect us to do our job, Speaker, and that is why I have brought in this legislation that will give us significantly more oversight, Speaker. One of the changes, Speaker, in legislation is that under the former performance agreement, we could not change that performance agreement unilaterally. Under the new legislation, Speaker, we will be able to unilaterally change the conditions under which we relate to Orange, Speaker. It will allow us to send in a supervisor, Speaker. That's a significant change and a power I wish I had.
Thank you. Be seated, please. Be seated, please. Be seated. Order. 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 New question. Member from Windsor West.
Thank you, Speaker. My question is for the Minister of Community and Social Services. Minister, in 2005, our government, together with both opposition parties, passed the Accessibility for Ontarians with Disabilities Act, or the AODA. I'm very proud of the Act and the positive changes that it has helped bring to Ontario to make our province more inclusive for everyone, regardless of their abilities. The customer service standard came into effect for Ontario businesses on January 1st of this year. Minister, can you outline